So with that, now I would like to call upon stage Mr. Gaurav Agarwal, the co-chair of Medical Device Committee, PhD CCI, and also the managing director and co-founder of Evolution Healthcare Private Limited. Our esteemed panelists include Mr. Praveen Mittal, Executive Director of Medical Device Export Promotion Council, Mr. Lalit Singla, Founder and CEO of Steerx, Colonel Hemraj Singh, co-founder of Ayushpay, Dr. Varun Bansal, the consultant, CTVS surgeon, Robotics and MICS, Indraprastha Apollo Hospitals. And this session is on VUCA leadership mantras. Over to you, Gaurav, sir. Over to you, Gaurav, sir. We can begin with the session.
So, good afternoon, ladies and gentlemen. The very testimony that we live in a VUCA environment is we have to compress a 1-hour session into 30 minutes and still keep it engaging while people are looking forward more perhaps to lunch than the session. So, we'll do our best. A lot has been spoken about VUCA, but personally I feel that today disruptions are not a situation that is the new normal that we live in. All of us have seen tectonic geopolitical shifts recently. I was to fly to Paris, and the flight that takes 9 hours took 16 hours because of closure of airspace, mobility restrictions. We've seen climatic shifts. So we live in the world where VUCA is the new norm. Now, my personal mantra for navigating VUCA environment is 3C, very simple framework: courage, conviction, and compassion. And we'll explore this more as we go through this constellation of leaders. I think it's a very, very empowered group of panelists as we delve, very diverse. But without much ado, what I do is I would get into the introduction of the panel. Praveen Mittalji, seated to my right, is an illustrious policy outreach advocate, starting as the Assistant Director and then the Assistant Secretary General at FICCI, and now as the Managing Director of the recently constituted Medical Device Export Promotion of Council. Warm welcome, Praveenji. Colonel Hemraj, an impeccably dressed Army veteran, MBA from IIM Ahmedabad to suit, and now the co-founder at Ayushpay, a leading digital health tech financing frontier. Warm welcome, Colonel Hemraj. Lalit Singla ji, catalyzing the next generation of medtech startups through mentoring and funding through a unique initiative called Steerx. We have a surgeon amongst us, Dr. Varun Bansal. Again, a very unique combination of cardiac surgery and an MBA from IIM Ahmedabad to suit, a very rare combination indeed. He's a practicing robotic and minimally invasive surgeon, cardiac surgeon at Apollo Hospital. Warm welcome, Dr. Varun. So we'll get started straight away. Praveenji, first of all, I would come to you. Global markets today are shaped by supply chain disruptions, as we've seen evidently in the times of COVID and otherwise. Shifting regulatory norms, we've made the transition from MDD to MDR 2017, and geopolitical uncertainties. And in the midst of all of that, India has a very, very aggressive target to go from $20 billion, hopefully in 25, to $50 billion. Now, as the Executive Director of Medical Device Promotion Council of India, how do you envision India's medtech exports being steered with clarity and conviction? A very loaded and layered question, but over to you.
So first of all, thank you for inviting me to this conference. We are a newly set up Export Promotion Council by Government of India, and the VUCA actually exposed also the Indian healthcare segment. If we see, COVID was the biggest lesson that we all learned, in which, as you rightly said, that the regulatory landscape, shifting regulatory landscapes, the geopolitical situation, the global landscape, everything taught us a lesson. From being an import-driven to changing the mindset for being self-reliant and then looking forward to the exports is India's, in a way, VUCA's response to the healthcare segment. There are a couple of things that were brought in by the government of India. If we closely analyze and look, the PLI scheme. The PLI scheme was launched for both pharma as well as the medical devices. And the launch of the scheme was not just to look at the domestic requirement or the self-reliance, because if you see, we had no stockpiling. We had zero capabilities in terms of PPE kits, the masks and everything else. But from being within months, we scaled up, and that scalability came through the demographic dividend of the manpower, the professionals, when we all stepped in together. So first of all, it was not like an isolated intent of being a leader, but a collective effort to put everything together and address the situation. So COVID, in all respect and in all terms, I think in a way, it exposed the healthcare system. It exposed the vulnerability of the healthcare system globally, and simultaneously made us work towards so that we can not just be self-reliant, but even help other nations, and that we did, right from vaccines to a lot of other things that we did.
So Pravinji, you brilliantly touched upon how Indian medtech industry and the hospital healthcare delivery system showed tremendous resilience in the eye of the COVID VUCA storm.
Exactly.
Now, my follow-up question to that, Pravinji, is how can India pivot from being a net importer of medtech to being an exporter? And what is your vision for the industry?
So, coming back to what you have just asked now, that if we look at the PLI scheme, which I was just talking about, we came out with the PLI scheme to be able to support, and as the word suggests, production-linked incentive scheme. If we have to look at $50 billion, your question number one, that will not just come from exports or from the, everything has to be put in together. We're looking at a basket of $50 billion by 2047. We will have to give opportunity to our Indian manufacturers to be an equivalent partner in the public procurement. I'm a firm believer of this. We will have to create that ecosystem of our MSME segment. We will have to identify components and the products wherein we as India can have cost competitive advantage. We will have to leverage the technology or the IT professionals. We will have to create that environment so that we become the answer to the global healthcare requirement. Further moving from PLI, if you see, we launched 3 medical devices parks. Today, there are 89 companies that have invested into the newly coming up Jewar International Airport's medical devices park. There are some 52 companies that have invested into Madhya Pradesh. There are some 27 companies that are investing into Tamil Nadu. Now they're all looking at expanded portfolios because PLI launched was very categorical in terms of the critical care equipment. What my suggestion here is that together on the drawing board, the government and industry will have to come together. We will have to look at each other not in isolation, but in terms of a collaborative approach. The good part today is that the FTAs which were signed previously about 10 years back, I don't think the industry was consulted in that. Today, if you talk about any FTA or BTA that is being signed up, everything is a very collaborative approach. I mean, I have been reaching out to industry for inputs. Any FTA that is being signed is with a clear intent, how can we create market access for our domestic Indian companies to be able to work at the global scale. I think the mantra lies in looking at what's available at the resource, identifying right products, be a part of the global supply chain, look at scalability, look at cost effectiveness. We will have to give equal status to the Indian regulator and the Indian regulator approved products, treat them equally in the public procurement, create that market which is equivalent to all, and I think this will all help us reach that $50 billion mark by 2047.
I think brilliantly summed up, Praveerji. Market access, government enabling schemes like PRIP, PLI 2.0, etc. And then most importantly, as you said, creating cost competitiveness. I think a brilliant mantra. Now coming quickly to you, Lalit Singhla-ji, medtech startups or startups in any environment survive in the eye of the VUCA storm. They look VUCA in the eye every day. And in your experience, funding cycles, market pivots, scaling decisions can very, very quickly change. As a company that is investing big time on creating the medtech leaders of the future, what is your personal mantra when ambiguity and complexity hit the hardest? And how do you, especially in these times, how do you take scaling and pivoting decisions?
Yeah, thank you so much, Gaurav, for the insightful question, and thanks to Manish ji also for having me here. I always get asked the questions around startups. First part of my career, I worked for large corporates, Fortune 50 companies over 23 years. But when I look at from the lens of VUCA, whether it is corporate or the startups, both kind of have to go through the same cycles. But startups by design have to be agile, nimble, adaptive, continuously driving innovation forward, rapidly prototyping, iterating, and coming out with newer innovations because of being small and lightweight, and hence they are the answers to the VUCA world. Because I believe VUCA is the only constant, right? So the world is always changing. It's not that COVID was the era of VUCA or anything has changed after COVID and it's a new world of VUCA. Like VUCA has always been there. That's the only constant that we always live in as humanity. And all the business leaders, corporate leaders, startup founders, like we should always tell ourselves that we have to be ready for continuously changing and evolving marketplace, continuously evolving and changing policy landscape, the geopolitical environment, no matter what, the consumer behaviors, all of that will continuously keep evolving, and we have to be ready for it all the time. Now,
so, Lalaji, I have a follow-on question. I think brilliantly put. What you're saying essentially is the crux of this meeting. But my follow-on question to that is that in times like these, compassion and conviction, I think those are two extremely important characteristics. All of us have seen that the journey from a TRL 5 to TRL 8 or 9 in a medtech device world is a very, very arduous one. And this is also called the valley of death, where 90% of the startups fail. And compassion has been spoken about in the various forums, where having a very compassionate approach, where having leadership that connects and shows them a vision is extremely important. What is your take on that, especially in the context of startups?
Yeah, so see, in the business of healthcare, compassion has to be always there. When you as a startup founder are building and putting your life behind building something, right, which is very unpredictable, you don't know whether it will see the light of the day, will it find success in the market or not. I think one thing that you have to continuously remind yourself as to why did I start to begin with? What is the purpose that led me to believe and solve for what I am solving? Rather than falling in love with the product or solution you are building, you should fall in love with the problem that you started to solve for, right? And why you took on that journey to solve that problem, right? For example, in the medtech sector, the problem statement that, hey, India as a country, like we are significantly under-penetrated. Like till date, we spend $7 per capita on medical devices. Put together everything that is consumed in hospitals, diagnostic labs, the instruments, OT instruments, ICU instruments, to whatnot, right? Everything put together, we spend only $7 per capita. Compare that to US, which spends like $425. The whole world average is over $100, right? So that problem statement doesn't change, whether COVID or not, whether wars or not, right? That $7 might move to $9, whatever. So there is a long uptick that we are overdue for, and medical devices as a sector for the country has to evolve. We till date import bulk of the devices for our own internal consumption needs. That is not changing, right? So if you started out to solve for something larger than life, right, you are saying that, hey, we will build best-in-class devices for India, for the Indian population, which exhibit the trust, which gives the world-class quality to people that, you know, even the Medantas and the Fortis and the Apollos and the doctors, they recommend and don't ask the patient the question, do you want the imported or do you want domestic, etc. Rather, you know, this is the high-quality instrument. Doesn't matter where they are manufactured, same quality, even if they are manufactured in India, right? So, you know, that trust has to be built, and you started out to solve for this need in the market, irrespective of how VUCA is evolving, right? Your need doesn't change, need still remains the same. Your solution might pivot, the way you are solving that problem might pivot, because now there is a newer technology, newer advancement, doing the same thing is easier or better now, right? So you use that technology to solve the problem that you started out to solve for. I think that's the first and foremost mantra for any leader, right? Always believe in the purpose, always believe in the problem that you started to solve for, and stay put for long horizon, persevere, be resilient, and position yourself to last for long, because you are running a marathon, you are not running a sprint.
So I think Dr. Lalit, you gave me a new mantra, purpose and perseverance. I think very, very clearly comes out from what you just mentioned. Thank you so much. Now, coming to you, Colonel Parmar, you have a dual lens. You combine military-grade discipline with entrepreneurial agility. You know, coming from a very structured army background and now leading a very unstructured digital healthcare funding platform, you know, how do you balance the agility required in a complex digital healthcare funding environment?
Yeah, thank you for the question, Gaurav. So I was in uniform for 2.5 decades. I've done 3 tenures in J&K, I've been to Afghanistan, I've also been to Iraq. There was a time when I was also responsible for the security of Baramulla. That was one of the most severely hit cities in the valley, especially during the early 90s and well into 2000. So I have actually lived VUCA life throughout the military career, and we are actually trained to operate in a VUCA environment. The term VUCA was first used in Afghanistan at the height of Cold War, when the Americans were facing an asymmetric warfare. There was no well-defined enemy. The enemy had an option to choose time and place with the required strength to attack you. They were fedayeen attacks. It also led to 9/11, and we know the aftermath, what kind of economic losses the Americans suffered. Right, so when I was in Baramulla responsible, I had one Rashtriya Rifles battalion under me. That's a very highly trained counter-insurgency battalion of almost 1,000 people. We would typically get intelligence at night that so-and-so house, there are X number of militants staying overnight. And thereafter we would launch a classic counter-insurgency operation called as cordon and search. We would surround that village into outer perimeter, inner perimeter, wait till the morning, and thereafter go on a house-to-house search. Now sometimes this information is very broad-based. You have no precise information how many militants are there, what kind of weapons they have, and which specific house they are residing, because sometimes what happens is they move from house to house. And sometimes these houses would have hideouts. They could dig deeper. You have taken dogs, you have searched the house, and militants are still inside and you couldn't find them. Sometimes you would get wrong information that the militants are in this house. You surround that house, they actually fire from another house. So in a typical VUCA world, our mistakes come in body bags. In the recently concluded Operation Sindoor, we had 1,000 options of attacking Pakistan. Our naval aircraft battle group was almost 300 kilometers from Karachi airport. Our armed forces were ready within the cantonments, and Air Force was ready to strike in strength. We just used about 20 plus BrahMos missiles. We have a stockpile of almost 1,500 and adding more and more. But we decided on one particular option. Okay, so to arrive at that particular kind of reaction among 1,000 actually requires leadership of the highest order. Today the world is in a flux. You know, there are trade wars, there is Israel-US conflict going on, Ukraine-Russia war, there are tariff wars going on, there are other economic disruptions, realignment of the supply chains. The world is moving from single or dual pole to a multipolar world, and India is at the forefront of this.
So,
Now drilling down.
Yeah, Himraj, sorry, in the interest of time, you made a very interesting point that
Yeah.
during a combing operation search, you know, looking for a bandit is like looking for a needle in a haystack. Now, when you start a digital health tech funding startup, you know, it's a very similar environment. You're doing something that is unprecedented. You know, what parallels do you draw between your experience from those kind of operations to bringing healthcare digital excellence in IoT?
So, thank you. When we had COVID, our health systems were overwhelmed. We did not have beds, we did not have oxygen concentrators, we did not have tocilizumab and other essential drugs, right? So my company that time was running 3 telemedicine centers, right? Because the patients, for the fear of infection, didn't want to visit the healthcare facilities, and suddenly telemedicine saw 600 to 800% spike, and thereafter it ebbed. So the market dynamics change pretty quickly. There are policy decisions. Till then, till 2020, there were no guidelines for telemedicine. The consumer expectations are also dynamic. They also change pretty rapidly. So we saw that this as a business line was not very scalable, and we pivoted. So one of the major things which we do when we do a startup is that we start with certain assumptions, and those assumptions, when the tire hits the road, sometimes you may be proven wrong. So the resilience of the leadership lies in ensuring pivoting in line with the scalability. So we pivoted and scaled up. So when we look at the entire healthcare industry, today 2/3 of the population is underserved. We have surfeit of technology, telemedicine, we have wearables, we have 1,75,000 Arogya Mandirs, we have remote health delivery systems now in place, AR, VR, robotic surgery. How do you marry technology to ensure equitable, affordable, high quality, accessible healthcare delivery to the last mile is one of the challenges in the VUCA world. PPP projects, certain investments into the tier 2, 3 cities from the legacy players because they haven't gone to the tier 2, 3 cities yet. Apollo's, Fortis Max Apollo, bigger hospital groups, they haven't really reached there. Some of the governments are going for PPP projects to bring that kind of healthcare delivery to the last mile. So our health systems have to be resilient. The leaders have to keep their manpower trained and be open to learn, unlearn, relearn to make sure that you provide high quality healthcare delivery
I think
to
what
the last
I
mile.
just learnt is that you're a living example of the provision and revision piece. You very, very clearly spoke about making a change when the numbers ebbed from telemedicine and pivoting in another direction. So thank you very much for creating a live example of how you navigated that complex and ambiguous world when the ground changed. Now coming to Dr. Varun. Dr. Varun, inside an operation theatre, split-second decisions are the norm, where a right or a wrong decision could be the choice between life and death. And yet, cardiac surgery requires years of rigorous preparation. Now, as a robotic and MIS cardiac surgeon, you face uncertainty every day in making clinical decisions. What parallels do you draw between surgical excellence and guiding teams or healthcare systems, towards excellence in this world?
First of all, I would like to thank you Munish ji, and thank you everyone for having me here. Without wasting time, coming to the question. So, I understand VUCA is life. Life is vulnerable, volatile, uncertain every day. And as Dr. Hiramat was right about it, the decision is between taking one stitch right or wrong. In cardiac surgery, there is no mid-term results. Either the patient goes home alive or he doesn't go home at all. He would not go limping. There are no intermediate results. So, when we work with technology and when we explain technology to the patient, we need to understand that the patient does not trust the technology. He trusts the person who's explaining, who's sitting behind the technology. When we explain devices, it's not about the device that the patient trusts. He trusts the person behind the device. So that decision which needs to be taken right then and there is extremely important and doesn't just come from experience, it comes from foresight as well. It's developing from insight, developing foresight. This might happen 2 days from now, this might happen 5 minutes from now. We are not gods, we cannot predict the future. But the answer to all these uncertainties are adaptability. None of the patients are same. Anybody can have any results. The same patient can have different courses of action over days or even hours. As another member of the panel said, vitals can change anytime. So this tendency of vitals changing every time is very, very prevalent in cardiac surgery. So taking the lead means, one, you have to be in the helm of the situation. Being the leader, sir would agree from army, if the general stands behind and doesn't lead the team, nobody would trust them. The surgeon, the doctor, the clinician, I would say, the doctors are several, the clinician has to be at the helm of the team, has to develop insight based on the experience and teachings, and has to develop foresight so as to see what can happen and what cannot happen and how it should be taken care of. VUCA is, again, it is going to be there. It is its only constant. We saw it in COVID, we saw it in swine flu. It would be there for any kind of diseases. People are getting sick every day, people are getting better. It's not just an industry. Industry comes from, one, reproducibility of results. I always say that reliability can challenge anything. Even VUCA can be challenged by reliability and adaptability. If you keep on coming with the same result over and over again, then people tend to develop trust in you. It doesn't matter who you are, it doesn't matter how old you are, it doesn't matter what background you come from, it doesn't matter whether you're polite or not, but if your results are good, people will take care of it.
I think you very nicely said that the best predictor of future is the past. And if you can show that you've had a very consistent past, especially in the medical world. Also, I love what you said about leadership, that leadership is about doing what you say and saying what you do. You cannot be preaching what you're not practicing yourself. So, Dr. Varun, just out of question, perhaps not of relevance to the topic that we're discussing, but there are matches where the whole team puts a brilliant collective effort, but the match is lost. So, coming to a clinical situation, you've done your very best, your teams have done the very best, and still you end up losing a patient, not because of a bad decision, but because there was something where the hand of God was larger than the hand of the surgeon. How do you deal personally to cope with situations like that? How do you motivate your team to go to the next surgery with the same courage and conviction?
So I would add to it, it could be sometimes due to a bad decision as well. We cannot always blame the circumstances or the hand of God for the misdemeanors we come across. Sometimes it could be a bad decision based on the clinical expertise or the knowledge, or it could be a bad act or maybe inadequate act which was supposed to be done 5 minutes ago and was not done. With all these all these instances, I would say, my teacher used to tell me that doing good is one part, embracing failures is another. Failures keep you humble. Manishji thankfully addressed me as a youngest cardiac surgeon who was accepted to be trained as robotic cardiac surgeon in the world. But to be humble, to accept failures, even if it's yours, your team members, or an act of God, it's very, very important. And equally, it's important to get back from it, do good to the next patient, to whatever circumstances coming next to you. One, you cannot lose ground because that is your survival. Second, your team cannot lose ground on you. They cannot lose confidence, they cannot lose hope. So you have to keep on working. There's a very famous saying in movie Batman, why do we fall? To get up again.
I think, Dr. Varun, you wear a very mature head on your young shoulders, and what I'm hearing you say is that while it's very important to be nice, but it's more nice to, while it's very nice to be important, but it's more important to be nice. So thank you very much. And Praveenji, coming back to you, you're heading a newly formed Medical Device Export Promotion Council of India. You have an uphill task from going from about $2.5 billion of exports to a very large number, multifold number. What could you do to inspire startups or medical device companies, some of whose founders may be sitting here, and give them the conviction that a Viksit Bharat, India will play a huge role, not only as the global pharmacy of the world, but as the global medtech supplier of the world?
Thank you, Varun. Thank you, Gaurav. Varun, very nicely said for your last question. I was remembering, I used to head Aero India and DefExpo projects at VUCA. And when aerobatic team actually performs those, air display at any of the Aero India shows, I'm sorry, I'm driving you out of the context. But in 2013 Aero India, we lost one of the Surya Kirans. And that time what we saw is suddenly the Russian fighters and the Surya Kiran rest of the teams, they all started taking off and flying over the sky. So that's the answer also, that it just keeps going and bringing in that conviction that everything is okay and you move on to the next thing. To your question as Medical Devices Export Promotion Council and the Viksit Bharat, I think Viksit Bharat, first of all, let me also put it in front. Today we are a $16 billion market. Very happy to share, we moved from 2.5 billion. The exports has touched $4 billion in the last quarter, which was in the month of March, we recorded $4 billion of exports. Yes, today if we talk about, we are large exporters of consumables and disposables, but I think the next wave is going to be another 2 years from now when we start really taking up the critical care equipments and the big, equipments on the exports map. As far as Viksit Bharat is concerned, I think $50 billion is a number, but the right policy in flux, cost competitiveness, as I said previously also identifying right products, and for startups also, identifying the right products. We are there to create market for you. We are constantly working with industry. As an export promotion council, it's important for us to reach out to various geographies. We are trying to understand the regulatory requirements of the various countries. We have started a new practice at the council wherein we are creating dossiers for the countries, that this is the requirement of the particular country, this is the disease profile of the country. Please reach out to us in case if you want any information on any country. We are all working towards one aim of creating Viksit Bharat, which will not just be a part of the global supply chain, but will be a global leader in the medtech space, because healthcare is an important segment, and I feel medtech is the key lever to be able to bring that change and transformation in the healthcare space.
Thank you so much for inspiring that confidence, and very, very happy to learn that we've inched up from 2.5 to 4 billion. Now, for paucity of time, as stimulating as the discussions and deliberations are, we have a very, very diverse and very dynamic panel. Maybe I would open the forum for a couple of questions, if there are any. Sure. Can a mic be passed on?
Thank you, Mr. Mittal. I was hearing about your particular statement regarding regulatory requirements of different countries, right? So I don't think really that you really need to reinvent the wheel there. It's very readily available information. But there is a challenge when it comes to a startup. Everything across the world, give you an example of US FDA. Per product it goes up to 40,000 US dollars, right? And the way, I'm sorry to say if there is a startup and you feel hurt, the way startups are working, they really have to change it completely. Because I always say from different platforms that all startups in medtech domain has to learn the language of regulation. It must reflect in their records right from the ideation stage. Why Indian startups are failing in many, many ways? Because they don't use the words which are used by the regulation across the globe. And the second problem is we are always in a hurry. I don't know why. Generate good data. The Export Promotion Council must conduct some sessions so that we can give them alignment. At the same time, I'll also say, please do not be dependent on doctors working in the hospitals or scientists working in ICMR or universities, because they also don't know this language. So you have to find out people who understand this language, and that will enhance the opportunity of putting the products for the world. These are altogether a different ball game, sir, and we really need to put it in a very right perspective. This is comments.
To answer your question, sir, we've already started at Export Promotion Council a series of webinars wherein we are inviting people. 2 sessions have already been done. We will. I've understood your thought process. So when I talk about, you said the information on US FDA regulatory requirement, on C requirement is all available. You're very correct. But I can tell you with conviction, 90% of the companies don't know the regulation. Second, do we know what the fee comparison is? Today when we are negotiating FTAs, the biggest problem for us is not just about the tariff barriers, sir. We keep saying that CE costs this much, US FDA costs this much. Apart from the tariff barriers, also you have non-tariff barriers, and which are more hurting us as an industry than the tariff barriers. We have conducted 2 sessions, one with DCGI and the other one with the Deputy Drugs Controller. Sorry, sir?
I want to mention you went to the wrong platform.
No. Let me tell you, sir, the people in this room also would not know. Sir,
I think, I'm sorry, I don't know your name, but
My name is Dr. Sanjeev Gupta.
Dr.
I've been in the regulatory domain for 30 years, and with great conviction I can tell you, nobody in CDSU can speak on C marking for 15 minutes.
Sir, they didn't speak about C marking. Hear me out. They didn't speak about C marking. They spoke about the work that CDSU has done, the regulatory approvals that are required. I can tell you another thing with conviction, sir, that half of the people in this room won't know what the export documentation is, where to go and access the free sale certificate. So Export Promotion Council is formed to be able to guide such startups and such people. We are not charging any cost. Please visit our website. We get a huge data from DGCIS. My colleagues here in this room, Sankalp and Ravi, they spend a week per month to put the data together to be able to actually access under 152 HSN codes what is the total export under each HSN code, and club together under 5 target segments. So there is a huge work that's happening. And going forward, we'll be starting a series wherein we are going to invite the foreign regulator to talk about the regulatory landscape of his country and interact with business leaders, the international business leaders of various organizations, that what are the impediments or the problems that they face, so that we are able to create an ecosystem wherein the small and the MSME companies can take benefit of the entire thing. So I think there's a lot which is to be done together. My only point here is how we can come together and put that in frame.
So Praveenji and Dr. Gupta, I think the ability to identify and address the knowledge gaps is the key for us to become a net exporter of medtech. But I think I can clearly see hypoglycemia setting in. And, for the lack of time, maybe just one question, not really a debate. Another question, we have some very distinguished panelists, two people who are leading the medtech funding space, a cardiac surgeon, young dynamic cardiac surgeon. Any question for them? Praveenji, I know, is much coveted and will be available post-lunch as well. But any other questions for our esteemed panelists other than Praveenji? Maybe one question and then we can close the panel. All right, thank you for the overwhelming response. No, Rajiv Chittarji.
My question is to Lalit actually. We're talking on a VUCA world and we can see the war patterns actually now raising the entire component manufacturing costs that are happening. India's done great in terms of Gati Shakti. However, we've not been able to weave it on a global basis. There are only a few factors that we're looking at. So how supply chain logistics as well as supply chain management is going to really have a VUCA moment? That's something which maybe you could. Sir, leadership से कहीं तो corporate boardroom से आएगा सर, वो उसी को आप लेके जाएंगे.
I was actually going to say the same because, you are better expert and there is an expert panel coming after us on this topic. I would just say that, hey, from the startups point of view, always be innovative in the thinking in terms of how will you do the fulfillment and distribution of whatever products and services you are going to come out with. The world will continue to encounter the kind of situations we are encountering it, whether it is real war, tariff war, etc. All of that will continue to exist. But logistics and fulfillment, just like regulation, have to be built into your product service offering from day one. Consider that, build those channels, build innovative partnerships, make the reach outs to the ones who have cracked it and partner with them very early on, because you cannot take everything on your own shoulders, right? If you are great at building the product, so be it. But then how do you distribute? You don't necessarily have to take it onto yourselves. I think that's my short answer, but we'll look forward to learn more in the next panel. Yeah.
So Lalit Singla ji just gave us another mantra. It's the era of collaboration and not competition. And with that, it's been my proud privilege to lead such a esteemed, such a stimulating discussion with such esteemed panelists. Thank you, Colonel Hemraj ji. Thank you so much, Praveen ji. Thank you, Lalit Singla ji. Thank you. And thanks a lot, Dr. Varun. And thank you.
Thank you so much for the insightful session. Let's take a picture. Now we would like to start with the felicitation. I would like to call Dr. Rajiv Chibbar and Dr. Amit Asthana ji to please come on the dais and felicitate our esteemed panelists. First of all, we would like you to felicitate Mr. Gaurav Agarwal, Co-Chair Medical Device Committee, PhD CCI. The next we have Mr. Praveen Mittal, Executive Director, Medical Device Export Promotion Council. Mr. Lalit Singla. Colonel Hemraj Singh, co-founder of Ayush Pay. Dr. Varun Bansal, Consultant, CTVS Surgeon. Thank you everybody for this insightful session. It was indeed a pleasure to have you all together on the stage with us today.